Welcome to another episode of the Mental Health Breakdown, where we take the mental health related news from the past week or so and we break down the stories for what their implications are on people's mental health care as a whole, and what it means for the professionals within the mental health field. Today we're going to talk about some of the longer lasting implications of mental health exclusions from abortion laws in the Carolinas. We'll talk about how New York City is suing multiple major social media companies for the damaging effects that they have on the public, especially for youth. And then we'll finish up by breaking down how the lack of diversity within the mental health workforce is affecting clients and the mental health field. So let's dive into it. Since the Supreme Court overturned Roe v. Wade in 2022, a lot of states have put laws into effect, or they had laws waiting in the wings to jump into effect for when Roe v. Wade was overturned, restricting access to abortions, things like that. I don't want this discussion to necessarily center around whether abortion is right or wrong. I think everyone has their own beliefs about that. But the interesting piece is that in North and South Carolina, both states have implemented stricter abortion bans last year. And as with most of these laws, there are certain exceptions in place for medical emergencies, except that in North and South Carolina's laws, mental health conditions and suicidal ideation are excluded from those emergency exceptions. And so what are the implications for that for people who might be pregnant and also dealing with mental health conditions? So one of the tricky parts is that a lot of medications you are not supposed to be taking while you are pregnant. And so this article says that while anti-abortion groups have long raised the specter of abortion spurring depression and other mental health conditions, the concern is actually different for people who live with mental health conditions. Being pregnant could put them at risk of having to discontinue the very medication they need to keep them alive. And especially when we're talking about serious mental illness, things like depression, bipolar disorder, schizophrenia, those are potentially life-threatening conditions that some people feel stable only when they are on their medications. And sometimes it takes years and years of work with a psychiatrist to get on a good balance of medications that helps them to function what they feel like is normally through life. And suddenly, because they are pregnant, they might not be able to keep up with that. And that is a huge upheaval, both in terms of the pregnancy as well as the implications for their mental health. This article cites Stephanie Berg, who is a psychiatrist in South Carolina. She says that the brain is just another organ of the body and the brain gets sick. We absolutely have to treat it just like we would with any other physical condition. And I can see the merits of that argument. A lot of times, what's going on is a brain chemistry issue. Either there's an imbalance in neurotransmitters or brain chemistry, or the brain is not receptive to something in particular, and some of these medications help to regulate that. One of the legislators involved in South Carolina did say that there's this perception that mental health can be too easily manipulated. And so there was never an effort to amend the law to include mental health provisions because lawmakers thought that mental health issues could be too easily manipulated so that people could get easier access to abortions when it wasn't maybe clinically necessary. So again, this is not a discussion about whether abortion is right or should be legal or not legal. There are some serious implications about how mental health is seen, especially for mothers who are already going through a huge transition in their lives by being pregnant, preparing for another huge transition to be a mother, as well as just the hormonal changes that go with this. And that can already disrupt the use of the medications they're currently using. And now maybe for the safety of the baby, they have to be off of these medications that have helped keep them mentally stable for so long. There are potentially withdrawal effects and things like that. And I have worked with moms, one of whom had bipolar disorder, who weaned herself off of the medication when she became pregnant and continued to stay off the medication afterwards. But you can't assume that that's going to be the case for every mother involved. Everyone's brain chemistry is too unique for us to just have a law saying that you're gonna have to be okay in your mental health without your medications when you're pregnant, just because it's potentially feasible that somebody might be able to pull that off. It's a one-size-fits-all solution for a very individual issue. So let's transition to talking about social media, and especially in New York City, they are suing multiple different social media companies. These are huge companies that they're suing. The lawsuit is against TikTok, Instagram, Facebook, Snapchat, and YouTube. So I guess outside of Twitter or X, those are pretty much the major social media companies. New York City is saying that These social media apps are worsening their youth's mental health and costing the city $100 million in mental health interventions and resources each year. And one of the arguments that New York City is making is that these social media companies particularly target younger audiences, teenage girls especially, making them more susceptible to body image issues, depression, and just other mental health issues overall, not to mention the addictive potential of these social media apps. New York City Mayor Eric Adams said that New York City is the first major American city to take combined steps of this magnitude and call out the danger of social media clearly and directly, just as the Surgeon General did with tobacco and guns. And I can see the potential for that metaphor here, where tobacco and guns had built-in risks to their use that need to be publicly called out and at least given a warning for anybody who would use those things, that it can have a harmful effect on your health. So I have no argument with the potential harms that the city is calling out with these social media apps. Absolutely, they are addictive, especially targeted towards children and teenagers who are in very formative stages of their brain development, that you teach them this immediate gratification of likes or comments, responses, shares, and things like that, that you train their brains to respond to the dopamine hits of social media and have very great difficulty with impulse control, self-regulation, emotional regulation later on in life. Absolutely, I see that. We also talk about the issues with body image. These are teenagers who are learning about boundaries, and social media tends to make private lives very public. And so teenagers are learning to navigate that, where complete strangers could have a lot of access into their lives, and the comments of other people, you create a potential for cyberbullying because everyone has so much access 24/7 to your profile. It's not just you leave school and nobody can see you or talk to you anymore. It's now your life is open for other people to evaluate, judge, have access to. That can absolutely be detrimental to somebody's mental health in terms of anxiety, self-image, body image, especially when we're talking about filtering on different apps and people becoming dissatisfied with how they naturally look because they get used to how they see themselves as a filtered, made-up avatar of themselves. Spokespeople from Snapchat and Meta, who owns Instagram and Facebook, they had comments. Snapchat said, "We feel good about the role Snapchat plays in helping close friends feel connected, happy, and prepared as they face the many challenges of adolescence." I talk about Snapchat in a separate video, so I'm not going to dig into that now. And Meta says that it offers more than 30 tools and features to support kids and their parents. Again, Mayor Eric Adams says, "Instead of talking to each other over lunch at the cafeteria, kids are absorbed in screens. Instead of playing at the park with friends, they are inside on a sunny day clicking and scrolling. Instead of learning confidence and resilience, they're being exposed to content that often leads to insecurity and depression." I think there's something recurring about, parents being scared that their kids are always inside and not outside like they were on a sunny day way back when. That doesn't resonate as much for me, but definitely learning the habits of how kids who are spending hours and hours on a certain app are being trained, especially when their brains are in a strongly developmental stage and learning and growing and making connections. I can see the potential where you wouldn't want a huge impersonal social media company shaping how your kids think for the next couple decades of their life. The article does say that this is going to be a difficult case because of a federal law called Section 230, which says that tech companies cannot be held liable for the content that users post to their platforms. That may be true. I am also sure that social media companies have a lot more control over the content that their users see than they will let on. And there have been separate cases about Instagram, about the way that their algorithm works and presents certain kinds of content to certain users. And so absolutely that can be problematic. So I did pull up New York City's framework for action that was published as part of this suit, saying this three-part strategy of holding social media companies accountable for making their platforms safer for young people. I think that's what the lawsuit is about. Educating young people and their caregivers, teachers, and doctors on healthy social media use. I think this is where New York City might get the most bang for their buck. And talking about the Surgeon General warnings on tobacco products, something similar where parents, teachers, educators, and the kids themselves are being taught about responsible social media use, having boundaries on social media, and just internet safety in general. And then the third prong is researching the impacts of social media on New York City youth. Absolutely. More research is definitely needed, especially this is a very new field where these are some of the first generations to have grown up on social media. So I think there's definitely something to New York City wanting to hold social media companies responsible. I don't know how much money they might get out of it, but I think directing some of those resources to prevention efforts, education for kids, teachers, parents might go really far in curbing some of the later on costs of mental health interventions for people who are struggling with social media or the mental health impacts of social media. All right, finally, let's talk about diversity in the mental health workforce. Obviously, this article hits home to me. I am a huge minority in the mental health care workforce, being both male and Asian. So according to the American Psychological Association, the APA, the mental health workforce estimates less than 5% of psychologists are Black. And now this is going to be a little misleading because the APA is specifically for psychologists, and that doesn't necessarily constitute the entire mental health workforce. You have psychiatrists, you have counselors, you have social workers, you have therapists, behavioral health specialists, all of the gamut. But not only psychologists are members of APA, so I think there's something to be taken here. One of the advocates cited in this article says that with our Black and brown communities, the stigma is still so high. We were taught that you do not speak your business, you do not say what goes on in this household. We have to break that stigma down to saying it is okay to seek a therapist now, the same as we seek a doctor when our limbs get hurt or if we get the flu. So yeah, absolutely, there's still a lot of stigma around mental health in minority communities, along with the historic mistrust maybe of the dominant white population who are overly represented in the mental health community. So there's kind of a double force working against minority communities seeking mental health. And as we see an expansion of minority therapists, that might help to break down the stigma and help people who are part of minority communities be able to reach out for mental health. So what I want to take a look at is what the trends are, and in terms of APA membership, to see whether it's trending in the right direction for greater diversity. So as of 22, again, this is membership in APA, so that does not encompass all mental health professionals, but hopefully is close enough to a representative sample. You have white or European, 74%, 6.8% Latino or Latinx, whatever you want to say, 6.8% Black or African, this is in 2022 by the way, and then 2.3% Asian or Asian American. So I'm in the minority. And then in 2022, 67% female, 33% male. That's about right. In grad school, we had a class of maybe like 20 to 30 students in our graduating class. 2 of us were male, so our ratio is pretty off. But what I will say is something that is encouraging. If we take a look at new membership details, so this is new members in 2022, only 57% were white or European American, 11% Black, 10.5% Latino, Latina, Latinx, and then 3.58% Asian. So you see increasing trends of new members are more diverse. So all that to say, I've talked about this before, you don't have to have a counselor who has the same background as you. When I have clients who specifically wanted a minority counselor or who wanted an Asian counselor, by the way, that's a very specific niche that you'd be asking for if you want an Asian counselor, as we see with these numbers. I tell them straight off the bat, I might share some cultural experiences with you. I am not going to assume that my experiences are the same as yours. I will still listen to you for your experiences, because if I just assume that, I'm going to be doing a disservice to them and to myself as a professional, just assuming that our experiences are the same just because we happen to be of the same background. What I will say is that it can be helpful for getting people in the door because they feel more comfortable or feel less alienated by someone who's in a different group or even a majority group where there might be other dynamics in play over their history or their background. Another benefit that I see of increasing diversity within the mental health workforce is that for a long time, research has been dominated by white males. And that's not to say that white males are intentionally sabotaging the research process or anything like that. It's just that certain populations have their own blind spots, and that's true of any group of people. And so when you have new perspectives coming in, there are new therapies, new interventions that are promising and are being introduced by minority groups just because of that different perspective or that different approach to mental health. And so even if you think about an old topic such as enmeshment, feeling like families are too dependent on each other or reliant on each other and not independent enough, that's a pretty European way of looking at things. And now if you have minority groups that are more family-oriented, more collectivistic, then when someone comes in who is of a minority group, who is still living with their parents, supporting them, and their parents support them certain ways, that doesn't have to be pathologized because you have this view that like, okay, they just come from a collectivist background and that's normal for their culture. It doesn't have to be a problem just because the textbook written by a bunch of people with a certain background and a certain viewpoint said that enmeshment is not a good thing. So both for clients seeking mental health, reducing the stigma of mental health in minority communities, as well as just an expansion of research and literature and perspectives in the mental health workforce, I see this move in a direction towards diversity as a great thing for the mental health field. And I do hope that that continues and that our numbers of Asians in the mental health community can increase in the future. Well, everyone, thank you so much for joining me for another mental health breakdown. These are important stories going on, from national issues like abortion, how they connect with mental health, and to relatively local and regional stories like New York City suing all of these big social media companies for the harm that they are doing to youth, and also something that directly impacts the mental health field in terms of just the diversity within the APA. Please make sure to subscribe if you want to stay up to date with mental health news and the implications of that for yourself, your mental health, and for the mental health field in general. Again, thank you so much for checking out this video. I'll see you next time.